Tim Martin, Councilmember Cisneros, Councilmember Pollard, Chief Pena, and Chief Fenner are also present, along with others of department heads. The Houston, and then from the top, let me let you know that Dr. Peter Hortez will be here shortly, not yet, but he will be appearing via the screen. Oh, yes. Okay. The Houston Health Department reports today 879 new cases of COVID, and that is, again, it's 879 new cases today, bringing Houston's total to 18,056. And as you can see, over the last 7 days, that number has moved dramatically. And so, again, 879. Today, we are reporting, unfortunately, 8 new deaths, people who have died as a result of COVID-19, bringing our total to 216. Relatively speaking, when you compare it to other cities across the country, being the 4th largest city, that number is relatively low. But again, it is growing larger than it has grown since March. So 8 new cases. Briefly, we are reporting on those 8, a person, female in her 60s, with underlying health conditions, a person, a male in his 80s with underlying health conditions, a male in his 70s, again, with underlying health conditions, a male in his 70s with underlying health conditions, also another male in his 50s with underlying health conditions, a male in his 80s with underlying health conditions, and a male in his 50s with underlying health conditions, and a female in her 80s with underlying health conditions. And even though we are characterizing them in that fashion, please bear in mind that they are members of someone's family, someone's loved one. So that brings our number to 216. Of that 216, 63 are associated with nursing homes and 3 with the Harris County Jail. So the number from the Harris County Jail has remained the same for quite some time. The number from the nursing homes has increased. So they're now, of the 216, 63 are coming from our nursing homes. The current surge in COVID-19 virus cases in Houston is real, and it is serious, and I want to underscore that. Our community's infection rate is 3 times higher today than it was 3 months ago. The positivity rate has gone from 3% to over 11%. The number of hospital admissions is increasing. The number of people requiring ICU is increasing. The number of young people being infected is increasing. And so it is real. And I want all Houstonians to take due note of that. The caseload across the community and in our hospitals is the highest it has been than at any point since all of this started. And we know how dramatic things were in March and April. But where we are today is more dramatic and more pronounced than it has ever been. In that vein, I do support the governor's decision to close bars and reduce restaurants' capacity from the current, to close bars completely for now, and then to reduce the restaurant capacity from 75 to 50% effective on Monday, June the 29th. And then, as you know, we'll be limiting outdoor gatherings to no more than 100, with few exceptions. Having said all of that, even before making that restriction of limiting outdoor gatherings to no more than 100, I do specifically want to point out and acknowledge Pride, the LGBTQ community, because their event was scheduled on Saturday. And quite frankly, as you know, that is a huge event celebrating Pride Month, and there's a lot of things to celebrate, including the recent Supreme Court decision. And so historically in this city, hundreds of thousands of people would be coming for a parade. This year they were modifying it to having a major march. Thousands of people had already signed up as of yesterday to be marching from Discovery Green to City Hall. But the board met on yesterday at 2 o'clock and made the decision, without even being mandated to, made the decision to protect the health of members of the LGBTQ community, as well as to, in the best interest of the city as a whole. They are all many of them all Houstonians. They made the decision on their own not to proceed with the march and the rally, but to have a press event highlighting what remains important for the LGBTQ community, the things they need, that we all need to continue to work on, advocate for, fight for changes in order to make sure that everybody is respected and treated fairly. And so I want to thank Pride, want to thank the LGBTQ community for making that decision not to proceed with their march and rally. Having said that, it does not diminish what we all need to be doing to advance the rights of everyone within our community. So thank you so very much. This virus will continue to spread uncontrollably in our community if we do not take drastic steps like the ones that I just announced today. We do have the ability to regain control of the virus and prevent a continued health and economic crisis. And it will take all of us working together to mitigate the spread by taking a few easy precautions to protect each other and our community, and one of those things is to mask up. Before I turn it over to Marvin, let me just say this. We have become the focal point of people all over this country about where this virus is now and how it is spreading. Wouldn't it be a fantastic point to make to the people all over the country, quite frankly over the world, how Houston, when it recognized what it is facing, how Houstonians came together like never before and flattened this virus again and slowed this progression of this virus again, and to do it in short order. What sort of message would that make? And what would it say to people all over the globe about Houston and Houstonians? I'm asking us to do it again. I'm asking people to show our resilience, and I'm hoping that we'll come together, mask up, engage in social distancing, and exercise proper hygiene. Let me bring on Marvin Odom, the Chief Recovery Officer.
Thank you, Mayor. Good afternoon, everyone. A different message for me today. Now, I am not an alarmist, if you know me, and I'm not one to use incendiary or exaggerated language in any way. This virus is out of control in Houston. If we don't act to get it under control, very bad, extremely bad things will happen. Sickness, death, our economy progressively getting shut in. Now, sickness, death, and a rollback of our economy, if that won't change behavior, I'm not sure what will. What each of you and everyone that you know need to do is simple, really simple. Wear a mask, stay 6 feet apart, and keep your hands clean. That's it. There's nothing political about this. Doing these simple things mean, in my mind, that you respect other Houstonians, and it means that you are in favor of returning to the strong economy that we've enjoyed for so long. Now, we are blessed with an amazing healthcare capacity in this region, but even that has its limits, and they are working day and night to do their part. You need to do your part. The City of Houston is executing a strong plan of response and recovery with all the aspects that we've discussed in the last couple of months. Strategic testing and contact tracing, ensuring adequate protective equipment, assisting vulnerable and at-risk communities, funding multiple initiatives around health and economic recovery, and many more. But now, it all hinges on Houstonians doing the right, simple thing. You need to demand this of yourself, and you need to demand it of everyone else. Thank you, Mayor.
Thanks, Marvin. And we have with us Dr. Peter Hotez, who is the leading epidemiologist not only in this city, quite frankly, around the world. So, Dr. Hotez, it's on you.
Thanks so much. Can everybody hear me?
Yes.
I'm always amazed when the technology works. Thank you so much, Mayor Mr. Rodham. I really appreciate the opportunity to be here. This is a tough day for Houstonians to have to roll back some of the opening. And we all recognize that this is a significant hardship on the people of Houston and in Harris County. We really had no choice. The numbers of cases was going up so dramatically, basically a vertical rise. It's what we call an exponential increase, where the numbers were dramatically increasing. And in contrast to what some of the statements you might be hearing, that it's a consequence of increased testing, that's simply not true. It's being paralleled by an increase in number of hospitalizations. It's being paralleled by an increase in ICU admissions. And typically that means within a couple of weeks, we may see an increase in the number of deaths here in Houston. So we had to act. I think another very important reason was when we spoke to our colleagues developing epidemiologic models at a granular level looking at the city of Houston, the numbers were pretty worrisome. That left the status quo meant that by early July, middle of July, we could see the number of cases on a daily basis increase 3 or 4 times what it is now, something along the lines of 4,000 cases per day, which would be absolutely untenable for us. So we tried hard. There was many decisions made to halt or slow the opening, and of course the mask, which is so important. But even those measures would not be sufficient, and that's why we're undertaking this under the mayor's leadership and Mr. Rodham, these measures today to begin rolling things back. And like the mayor, I'm also optimistic that we can get our arms around this and get back to some level of normalcy. There will be this period of difficulties and pain for a lot of people. The people that I worry about the most, especially, and in my discussions with the mayor, I know this is very heartfelt for him, are the low-income neighborhoods, where it's more challenging to do the social distancing, where people who live in poverty have higher rates of comorbid conditions such as diabetes or heart disease, and are more likely to go into the hospital or in the intensive care unit. And there was an urgency to protect those individuals. Another reason, of course, is that people in low-income neighborhoods, typically for their employment, don't have the option, like many of us, to work remotely or to work by Zoom or Skype. They physically have to be in the workplace, and there was an importance of protecting them as well. So we recognize the hardship. This is a hard day for Houston, but a necessary step, and I congratulate the mayor, Mr. Rodham, for taking the leadership to make tough decisions to keep us safe and at the end, really to save lives. And these measures today will save lives. Thank you.
Thank you, Dr. Hortez. And let me just say, it's requiring all of us to do our part. We're certainly asking everyone to do our part. Businesses are staying open, so there's no stay-home order. But there are occupancy limits, and social distancing is important, and wearing masks. And so we're still expecting other businesses that are not being closed, like bars and clubs at this time, to please do that. And then firefighters and police officers will certainly be out and encouraging people to do that. And where people are just blatantly abusing the occupancy limits, we will have the wall of shame for them, and they will receive the WAS award, the Wall of Shame award, exclamation point. So that's important. Now let me bring up now Dr. Peirce, Dr. David Peirce.
Thank you, Mayor, Mr. Rodham, Dr. Hortez. So this has been an eventful day. It's also been an eventful week. 2 days ago, the CEOs from the TMC got on and basically said that they feel that they will be able to handle the load, and that is great news. We've been working with them throughout this period, and theirs is a daunting task. So we look forward to them being able to achieve that task. Now, that doesn't mean And I wanted this to be clear. This doesn't mean that anybody needs to take their foot off the brakes. That is not what they're saying. They're saying that they're going to work very, very hard, and having some insight into what they are doing, there are some dramatic steps that the hospitals are being forced to take in order to be able to manage this load. So please don't misunderstand their message. Their message is one of reassurance, but it is not one that should be misinterpreted to think that this is any less of a problem than everyone else is saying, and that is important that we don't get a mixed or confusing message there. The governor's move today, from a standpoint of a public health professional who understands epidemiology, we hope will be very effective, but keep in mind, this virus is breaking every rule. And so we've been saying since the beginning that from a public health standpoint, when you make an intervention into a community, it generally takes about 2 weeks to see that intervention on the numbers, or in the numbers. This virus is so insidious that we aren't seeing the impact until 3 to 4 weeks sometimes. So if you consider that in Texas, the governor lifted the restrictions or opened up to 25% of restaurants on May the 1st, and then he was probably advised to stay, to watch for 2 weeks, and that's why I went to phase 2 on the 18th, 18 days later. Well, we saw the numbers begin changing in terms of hospitalization beginning around May 21st, 23rd, so that is into the 4th week. So I bring this back to the fact that the governor made those changes today with regard to bars and restaurants. We should expect that for the next couple of weeks we will continue to have rises, which, getting back to my original comment, that it is going to become increasingly challenging for the hospitals to continue to be able to maintain the load as they've assured us that they will. The only thing that we can do is to do everything that we can to make sure that all of this preparation is done where the impact really occurs. So the governor can do so much, the hospitals can do so much, but if we really want effective change, it's going to be what you've heard 1,000 times now: wear the masks, stay 6 feet apart, don't gather, wash your hands, wash clean surfaces. Those are the actual things that actually make it happen. The governor's rule today, or order today, is a governmental way of pushing that. But as we as Texans, if we don't make that a reality, that we're going to continue to be in this situation. So while it's some reassurance that changes are being made, it's still up to each of us as individuals. The last thing I'll say is that the average age of people being admitted to hospitals from our data looks like it has gone, admitted, but testing positive, looks like it has come down from just under 50 years of age to right around 40 years of age. And when you consider that the number of folks who were getting tested has also increased in the 20 to 30-year-old age group, that shift in the average age, it isn't just a 10-year shift. It actually calculates to about a 30% shift. So that the average age of people who are infected is shifted downward to a younger group by about 30%. That is huge. That is very significant. So once again, the elder folks appear to be, and that includes myself, appear to be very diligent, and as a result, we're seeing less and less people my age and older testing positive, but we are seeing the increase in those younger folks. And so we were all young at one point. We all understand that mentality. But really, we call on the folks of all ages to encourage everyone else of all ages to wear a mask, stay 6 feet apart, and wash your hands.
Thanks, Dr. Purse. And on my wall of shame, I think I said WAS, or you may have heard me say WAS. I said WOS for people who misheard what I said. You know, I do know how to spell. Okay, wall of shame, WOS. That's what I meant. I may have come out differently, but and I'm still young, quite young. I'm a millennial. All right, Chief Pena, come on, Fire Department.
Thank you, Mayor. So I want to drive home the point that's been made here by several members, certainly the mayor, Dr. Purse, and Mr. Marvin Odom, is that this virus is no joke. It's spreading throughout the community. We're seeing the effects of that in the number of 911 calls that we're responding to. In the last 3 weeks, we've seen an increase of over 20% in 911 calls. The number of people that we're delivering to the hospital is also increasing exponentially, and that's having an effect on our unit availability. This is an issue that we're going to see moving forward, because our firefighters are out in this community as well. As the community spread of the virus happens, our firefighters are exposed to that same virus. And what we're seeing is a drastic increase in the number of quarantine firefighters over the last 3 weeks. It's gone up by over 150%, the number of firefighters that we have in quarantine. Today, it's at 186. We've had over 104 firefighters that have tested positive for COVID-19. Of those, 54 have returned to work, but we have 180 in quarantine and another 50 that are positive for coronavirus. Taking over 200 firefighters out of the game, so to speak, is having an impact on our ability to service the calls for this community, to service this community. So that is something I want to drive home, is that we're not defenseless against this virus, but certainly denial and complacency are as much of a enemy against this virus as the virus itself. And in helping to combat and stem the increase in exposures, the steps are simple, and you've heard them here before. You've heard them from the mayor, you've heard them from Dr. Peirce, Dr. Hotze, you've heard them from Marvin Odom. It's simple. You wear your masks, proper hygiene, and physical distancing. It's going to make a huge impact in flattening that curve, which will allow more capacity in our hospitals, and it will allow capacity in the 911 system to be able to service the needs of this community. Thanks.
Chief Fenner with HPD.
Good evening, everyone. Thank you for your leadership, Mayor. Just want to hit on a few points, and don't want to repeat everything that's said, but we live in a sophisticated city. Whenever I'm traveling over the nation, I always brag on that. And here in this city, we've been through a lot of difficult times. We're there again. So everybody just needs to stand up and do what they need to do. But I just want to share a few HPD numbers, because just as Chief Pena said, we have to respond and protect our citizens, and we'll continue to do that. May 29th, we only had 47 employees tested positive. Year to date, 205 tested positive. 75 of those have returned to work. Current numbers, we have 158 employees quarantined as I speak. 130 of those have already tested positive. We've tested 2,316. So everybody needs to do their part. And as just the mayor said, we've never been a city where we try to come out and write a whole lot of tickets and throw people. We want education, and everybody should be educated by now. But as far as the law enforcement go, we're going to be out there, and we want volunteer compliance. But in front of that, it should be love and concern for your neighbor. And the message to the young people: everybody think they're invincible, and you know you're too young to get it. Dr. Peirce shared the numbers with you. That's where we really need help. Be smart about it. Don't get infected and go home and take it to your mother, your grandmother. Let's just do the right thing here in Houston. Thank y'all.
Thank you, Chief. The Health Equity Response Task Force is holding a virtual town hall this coming Tuesday evening for Phase 2 of our Complete Community Initiative. This will be an opportunity to come together to hear some of the concerns of residents in these neighborhoods in the face of COVID-19. This is a virtual meeting for residents of Alieve, Westwood, Fort Bend, Houston, Cashmere Gardens, Magnolia Park, Manchester, and Sunnyside. And we have placed a link on the City of Houston's website to register for a town hall. And of course, this is one of the additional brochures or pamphlets, leaflets that we are putting out: wear a mask, save a life, which is critically important. And so let me just say again, a lot of talk about where Houston is and the numbers that are rising. This is our opportunity as a city to pull together like never before. And so we are all asking, all Houstonians, to do your part collectively to wear this mask so that we can slow the progression of this virus. What a story it will be 3 weeks down the road if the headlines across the country is that it seems as though this virus was going to affect thousands of people in our city. But working together collectively, we flattened that curve again, and we slowed the progression of this virus. We kept our city open and moving forward, and what a story that will be. So hashtag Houston, we can do this, okay? Hashtag Houston, we can do this. I know we can, and I know we will, and I'm asking us to work together like never before. Having said that, we'll take questions from anyone. And I don't know if Dr. Peter Hotez is still with us. He is still there. Okay. So any questions to any of us or to Dr. Hotez?
Well, I've got the pool question.
Okay.
So here we go. What is your response to the governor for scaling back, and do you think it's adequate?
Number one, I support the governor's move to scale back. I support closing clubs and bars. They were just out of control. Many of them. I won't say all of them, but many of them. Reducing the occupancy for restaurants from 75% to 50%, I support that. Allowing local governments to control any outdoor activities outside of 100, beyond 100, I support that initiative. And in so doing, for example, the permitting department, for the months of July and August, we are reevaluating any outside activities with a population of more than 100. So I do support that. And then, again, reemphasizing the importance of wearing the mask.
And, Mayor, you said that the clubs and the bars, they were out of control. Certainly starting on Memorial Day, we also saw those pictures.
Right.
But how many citations were actually written, were any?
Well, I'm not in the best position to give you a number, certainly can, but what we were emphasizing, for example, number one, our monitors, inspectors were going out, taking a good look at what people were doing. We supported the efforts of the TABC. As you know, several of those bars and clubs, permits were pulled for like 30 days. We supported that. And even this week, the goal was to plan to go out in massive force to inspect those clubs and bars and to join with the TABC in encouraging their license to be pulled. The fact that they are now being, as of noon, closed, that's a very positive step in the right direction.
But what kind of enforcement, what does enforcement mean? Are there actually tickets written?
No jail time, okay? Could be up to a ticket of $1,000. That is what was allowed by the order that was put forth by the governor.
And just in terms of testing, the number of tests that are still available publicly,
Yes.
the wait times, and is anything being done to get more of them?
On more testing sites, the answer is yes. I think right now we have about 27. I think the other day, if I'm not mistaken, we opened 6 additional testing sites. But we're wanting test sites all throughout the city of Houston. The demand for tests has been growing each and every day. But let me call on Dr. Peirce.
So some other good news for today, which I failed to mention, was that the federal government extended their support for the city of Houston, our stadium-based sites, for another 2 weeks. So that gives us some more time to build more infrastructure so we can maintain a large number of test sites across the area. The demand has grown significantly, and we have heard that there are people who want to be tested and are having trouble getting testing. So we're working on that. There are a large number of test sites across the region. And quite honestly, it fluctuates week to week with the resources that we can get. We're working with multiple partners. We're working with the Texas Department of Emergency Management. We're working with UMMC, for example. We're working with the fairly qualified healthcare centers. And so it has to shift a little bit from week to week. But to the degree that we can, with whatever resources we get, we will increase testing until we meet the demand.
And clarify the positive rate on those tests. It has
Right.
gone up.
So, the positive rate, it's a percentage. So of 100 people, several weeks ago, so for every 100 people, about 3 were testing positive. So now we're up over 10%. Now that is a more than threefold increase. So when you hear people talk about there's being more tests and that thing, it's missing the point that the rate of positive test results is going up, which reflects that there are more individuals within the community that are carrying the virus. And let me point out, that means they're carrying the virus so they could spread it. That doesn't mean that they're sick, and this is one of the challenges with this virus. People are infected, they don't know it, they're able to spread it, and that's why it's so, and I used the word earlier, that it's an insidious virus, and that's exactly what it is.
And there's some questions from KRIV. They said that the Vice President advised Americans that the increases in the Sun Belt were outbreaks in certain community and not so much a sign of an increase in cases in the overall picture. Do you feel it's just an outbreak, or do you think that's going to continue to grow?
It depends on how you want to use the word outbreak. In terms of continuing to grow, depends heavily on how much people hear and adhere to the message that we're trying to promulgate today. So this is manageable if we start doing what's asked. We've already done it. And here in Houston, the mayor pointed out, you know, here in Houston, we did a tremendous job of keeping this virus under control right up until we didn't. So we can do it.
Okay, my question goes back to the mayor again. The county judge.
One second, because Dr. Hotez, do you want to amplify on that last question?
Yeah, happy to. I heard the press briefing and then commented on CNN afterwards. I wasn't happy with the use of the term outbreak. I think it tended to not convey the full extent of what we're facing in the United States. We are seeing a massive resurgence in the major metropolitan areas. These are, and I think the other term they used a lot was hotspot, and these are not hotspots. These are the largest cities in the United States. This is Phoenix, this is Los Angeles, it's Houston, it's Dallas, and the resurgence is very intense, very scary, and right now it's going unabated, to the point now where the number of cases is now exceeded our initial record peak back in April. So it started going down. Now it's continuing to go up in a very dramatic way, and the models, you know, at times are, I don't want to say apocalyptic, but they're very, very concerning. So this really creates priority for taking action right now. And I would imagine that conversations like the one we're having this afternoon are underway in all of those major metropolitan.
And people can take the truth. I think it's important for us to be upfront and very truthful with people. People need to know the actual facts and what the truth is, and then they can govern their actions accordingly.
And going back to the whole enforcement issue, you said there will be a wall of shame, and I assume that would be published on the city's social media sites, correct?
Published on the city's social media site, put on a big board that when we're having these press conferences, that you all can see them and the general public can see them, because quite frankly, it's very, for most businesses, they need customers. They need people walking into their doors, and people need to know who's being responsible.
Do you think that may be more meaningful than a fine?
Well, I think in the end, it's hard for any business to survive if they don't have customers. And the people themselves are going to say whether or not they feel comfortable in what people are doing, what businesses are doing, what establishments are doing. So I think it's a combination. It's not either or. It's a combination of all of these elements. I'm not saying we're going to do away with fines, but I'm simply saying that we need all of the tools available to us to encourage good behavior.
And one more question, will city parks, pools, recreation centers, will those remain open?
The pools never open.
They're not open this summer.
The splash pads never open, and they are not opening. The basketball courts are not open. They have not opened. We are not encouraging in a sense, any group sports in large numbers. We're not doing that. For example, just like with the library, we are postponing the next phase of opening. So we will ourselves take the initiative. We will, employees where they can't work remotely, with social distancing, they will continue to work remotely. All of those things will take place.
And I know you're emphasizing the mask, the hand washing, the social distancing. The county judge is asking people to stay home if it's at all possible. Is that also part of your messaging?
Well, number one, we don't have the authority to put forth a stay-home order. The fact that clubs and bars, their activities have been suspended, that's a good thing. Reducing the occupancy from restaurants from 75 to 50%, that's a good thing. Now it's very important, for example, for people to put on their masks. We know masks work. And if people would do that, then and all of the other component parts, those things work, okay? And let's see, we'll continue to look at the numbers. We'll continue to look at where things are and the success that we are having, and then we will govern ourselves accordingly.
And if I could ask Dr. Hotez a question, this will be the last of the pool questions. And this is from KHOU. Dr. Hotez, you criticized the White House COVID task force in several areas. What models, trends, or facts do you think they should be looking at rather than the ones there currently are?
Well, you know, my issue with the White House task force is that it's that they're disorganized and they're often uninformative because they don't present the data in a way that's easily understood or interpreted, and they don't contextualize, provide an overview. So I always come away from those White House task force briefings left quite unsatisfied, and it was the same today. So it's really hard to, basically what I came away with was that they were unable to articulate why what's happening is happening in the American Southwestern metro areas. They were unable to articulate where they think this is heading. They were unable to identify any predictive models of what they can expect, and they were unable to articulate any plan that they have beyond saying they will support local health authorities when they can. And so, it was very hard to come away with anything tangible.
And to clarify, you said that based on the models that you've been looking at, there could be as many as 4,000 cases a day reported in Houston, Harris County, and that would be in the next couple of weeks if it goes at the current rate?
Yes, that's correct. This is the models that I look at. There's and they're not complete. They're not always completely aligned. I look at the University of Washington IHME models. The 4,000 number comes from the University of Pennsylvania lab, CHOP Policy Lab. You can go to it by going Policy Lab. Just Google Policy Lab and CHOP and COVID-19. It will take you to a bar that lists projections, and you can scroll to your individual county. I tend to like that one over some of the others because it's more granular for individual counties, where others just provided for the entire state. And then Lauren Myers at University of Texas, Austin has some very useful models, and UT School of Public Health as well. And there's a lot of good information on both the city and county health department websites. And then Houston Chronicle's got a wonderful website as well too. But if you're looking at predictive models, the Philadelphia Policy Lab, UW, Lauren Myers at UT Austin are the ones I look at the most.
And we keep asking you about vaccines. What's your prediction for when one would be available?
Well, thanks. We to accelerate a recombinant protein vaccine, which we hope to be in clinical testing by the end of the year. We're not currently part of the Operation Warp Speed program, which is only 5 vaccines selected by the major pharmaceutical companies. Those are beginning to go into phase 3 trials later this summer, with the Moderna vaccine as the first one, and others will follow. And it will take approximately a year to collect sufficient information for whether any of these vaccines actually works, and whether it's safe. And potentially by Q3 2021, maybe some of the first vaccines will roll out. But I would also caution to say that the initial vaccines may not be the best in terms of giving the highest levels of protection. And we will still require some level of public health infrastructure along the lines we're speaking about today In other words, I think there's a misunderstanding by the public on how these vaccines will work. They, at least to begin with, they may not be replacement technologies. They will be companion technologies along with a lot of the public health infrastructure that they have. So that's a very long-winded way of saying it's going to be really important that we pay attention to messages such as the one we have today. Well, important for everyone to have situational awareness and keep up with the news and watch what's happening in order to make the best informed decisions for yourself and your family.
Thank you, Doctor.
Dr. Thompson with H&D Magazine. You've been writing a lot and speaking on the relationship between poverty and health, especially in the National Tropical Medicine School, where you're the dean. There is this issue of testing. And you know, the president of a country like America, whatever he says is very, very important and should be taken seriously. When you begin to discourage testing in certain communities, especially communities which are minority communities with a lot of poverty, you are actually wanting the people to die indirectly. So from your experience, from your write-ups on the relationship between poverty and COVID, what would you say is this, and what advice do you have to give as to reduction in testing, knowing that the testing will help people in those minority communities to make better choices? Thank you.
Well, what I would say is the one common piece to every elected leader I've worked with in Houston and in the county, the mayor, the county judge, the members of the Texas delegation, so one of the first things they bring up is they're worried about testing in the low-income neighborhoods. And I have to say the mayor has made this his top priority. I cannot have a conversation with the mayor unless he first brings this up with me. And so I can tell you there is a profound commitment there. So despite, I don't really quite understand that whole story with the White House and what that's all about. And I haven't paid that much attention because I know that the city and the county are absolutely on top of this and committed to it. And I'm sure the mayor can elaborate.
Thank you. And that's absolutely correct. This virus is an equal opportunity abuser with a disproportionate impact on at-risk and vulnerable communities. But it is an equal opportunity abuser.
And Dr. Hotez, I have one other question that just came in. How long will it take to contain the virus with Governor Abbott's current orders, and are those orders enough?
The answer is I don't know. And also with the red alert system and how liberally or literally that's going to be interpreted. And so there are too many unknowns for me to say. All I will say, I think Dr. Peirce mentioned that it'll take a couple of weeks to know what these trends are going to be like, and we'll know when we know if we start seeing a decrease. I do think if we continue to see a more dramatic acceleration than we'd hope, and if these numbers continue, I will continue to use my voice to advocate for additional measures. So I don't know. I do think things will be better because of today, what's happened today and the last couple of days. Exactly how that will impact the inflection point in terms of reducing that very aggressive and very frightening slope, it's too soon to say.
Thank you. #Houston, we can do this. Thank you so very much. Thank you, Dr. Ortiz.
Thank you very much.
Thank you. Thank you, council members. Thank you all.